Good day, we are the Group 6 and we are going to discuss the Lesson 6.
First aid. So what is first aid? We already know that first aid, it is the treatment given to someone who was injured. What is a first aider? The main reason why is first aider is responsible for someone who was injured and who was someone who are going to the injured person and treat them quickly as soon as they can. The first aider, they are the people who are in charge for doing that. So there are some steps that should be observed when approaching a casualty. First, danger. Before approaching the casualty, always make sure the area is safe. Number 2, response. Check if the casualty is responsive or unresponsive. 3, airway. Next, you need to check that the airway is open and clear. Or breathing. You now need to check if the casualty is breathing normally. 5, circulation. There are some possibilities that the surroundings may fall the debris or anything else that can harm the first aider. So there are mechanisms to assess accident or illness. So the first aider must be aware of that kind of information. The common mnemonic is ABCDE. Airway, breathing, circulation, check for any external bleeding, disability, mental status, and peripheral nervous system. E, expose the casualty for further assessment and treatment. Casualty positioning. It should be going to stable the position of the casualty or let them rest, and they should be look for any other injuries or of the parts of the body of the casualty and check for their breathing. Implementation considerations. In certain circumstances, the casualty should remain in the position in which they are found until professional help arrives. Good. Some circumstances may come. They should be wait for the other professional to help them assist the casualty immediately. Call for help, EMS, or further help. As a first resort, the EMS provide treatment on the scene to those in need of urgent medical care. So they arrive quickly and help the casualty immediately going to the hospital or nearest hospital. That's all.
Hi, my name is Boqueo from BIT3H FSM-B. So the lesson that I discussed for today is all about the medication administration. In other countries, meron lamang specific medication or condition that layperson is allowed to medicate. The following are examples when a first aid provider may administer the medication. So the first one, to syempre kapag magme-medicate ka, kailangan mong mag-recognize muna ng situation. So the second one, unawain ang mga contraindiction at sa mga panganib na pagbibigay ng isang particular na gamot. So the last one is bigay ang gamot ng eksakto tulad ng nareseta sa'yo. So the second lesson that I tackle is all about the industrial safety management. This management refers to all of operation and events within an industry in order to protect its employees and assets by minimizing hazards, risks, accidents, and near misses, like severe bleeding and severe external bleeding. So what to do if mangyari sa'yo ang severe bleeding or external bleeding? So the first one is tanggalin or i-cut yung damit upang ma-expose yung sugat. The second is ilapat ang direktang presyon sa sugat gamit ng iyong mga deliri, gamit and malinis na tela or gumamit ng malinis na tela or gauze pad. So the second one is panatilihin ang pagdiin upang makontrol ang dugo or ang pag-bleed para hindi maubusan ang dugo ng nasugatan. So the second one is tulungan makahiga ang may sugat sa kumot or sa pin upang maprotektahan siya sa lamig. So the second one is i-secure ang bandage na nilagay, talian na mahigpit pero hindi ganun siya kahigpit para hindi masaktan ang pasyente or yung nasugatan, at tumawag na sa emergency or dalhin sa malapit na ospital. So ang gagawin naman if special case if there is an object in the wood. So ang unang gagawin ay kontrolin ang pagdurugo sa pamamagitan ng pagpindot ng mahigpit sa magkabilang gilid upang maitulak nito ang nahiwa upang magdikit ulit ang balat. Sunod, upang maprotektahan naman ang sugat, balutin ito ng malinis na piraso ng gasa or damit. So the last one, call the emergency hotline or dalhin na sa malapit na ospital. So what to do naman for internal bleeding? Bleeding inside body cavities may follow an injury, such as a fracture or a blow from a blunt object. For splinters naman po, maaaring pumasok ito sa balat at pumasok sa loob ng ating katawan, katulad ng maliliit na kahoy, metal o salamin. At may panganib itong dulot, maaaring maimpeksyon dahil bihira lamang ito linisan. So ang dapat naman natin gawin, if may pumasok na maliit na kahoy or salamin sa ating katawan, una ay linisan ng area na napasukan ng maligamgam na tubig at sabon. For example, kahoy na maliit, hawakan ang magkabilang gilid ng daliri at pigain ito. Sumunod, pisilin ang bahagya ng tuwid sa parehong anggulo na napunta sa balat, siguraduhin hindi ito masira. Sumunod naman, maingat na pisilin ang sugat upang mahikayat ang kaunting pagdurugo upang makatulong ito sa pag-flush ng anumang natirang dumi. So the last one is, pag natanggal na yung nakapasok sa daliri mo na maliit na kahoy, ay wash again with clean water and soap and dry the wound and cover with a dressing. Yun lamang po. Thank you.
So I am Estuaria and Kenette and our next topic is all about poisoning. So poisoning is any illnesses that is caused by exposure on some pwedeng bacteria or viruses, but mostly sa toxic. So may poisoning na man-made na nakukuha natin sa drugs, sa chemicals na pwedeng makita natin sa bahay, or if intentional yung poisoning. Meron din naman na poison na nag-occur sa nature. For example, mga poisonous plants natin, meron yung mga yan. Meron din naman yung mga nai-ingest or sa insects, yan, sa mga creatures na nag-produce ng venom tulad ng snake, yan. Swallowed poison. Swallowed poisons are chemicals that are swallowed that may harm the digestive tract or cause more widespread damage if they enter the bloodstream and are transported to other parts of the body. So next is kung ano ba yung dapat natin gawin if makakalunok tayo ng poison or papunta sa balat natin. Yan. So una is pag conscious yung patient na nakalunok ng poison, pwede natin siyang tanungin ano ba yung nalunok niya, gaano kadami, and gaano katagal na. So second is tumawag tayo sa call poison control or call 911 para sa emergency help. Next na gagawin natin is i-monitor natin or i-record natin yung vital sign ng poison or ng casualty. So meron ding special case if yung lips natin is burned. So ang pwede natin gawin is painumin natin or idampi lang natin dun sa labi niya yung cold milk or yung water. Yun. So caution, kung tayo mag-attempt or mag-i-induce ng vomiting. If yung patient is nakalunok ng poison, mag-wear dapat tayo ng mga protective gloves, goggles or mask. If yung casualty naman is unconscious or wala ng malay, hindi humihinga, pwede natin siyang bigyan ng CPR. If yung casualty naman is may chemicals na napunta sa bibig niya, gumamit tayo ng face shield or pocket mask para at least hindi ma-transfer sa ating poison. So next is yung your aims. Dapat ma-identify natin kung ano ba yung poison na dumako sa balat niya or yung nalunok niya. Dapat din na urgently papunta natin sa ospital yung victim para sa removal ng poison. So our next topic is fracture. So fracture is parang common naman sa atin. Pwedeng ang cause nito is pwedeng sa basketball, pwede namang nagdaganan ng kung ano. Next is yung open and closed fracture. Ang open fracture is if nag-break open din yung skin, nag-break yung bone. While the closed fracture is nag-broken lang yung bone pero hindi umopen yung skin mo. So next is yung stable and unstable fracture. So sa stable fracture, ito naman is yung broken bone natin is hindi natin magalaw dahil nga na sirang-sirang talaga yung bone natin or impacted na siya. Risk dito yung bleeding and yung further damage naman is minimal. So next is yung unstable fracture. Ito naman yung broken na yung bone mo pero may chance pa rin na nagagalaw yung part na may nasirang bone. Pwede tayong maka-experience ng deformity, swelling, bruising, especially may pain or difficulty na magalaw yung brasong na-fracture, shortening, may bending or twisting of a limb. Meron din for breathing, signs of shock if the thigh bone or pelvis is fractured. And lastly, pwede rin magkaroon ng difficulty sa paggalaw ng rib na broken. So, ano nga ba yung dapat natin gawin if may nakita tayo or may casualty na alam natin na may open fracture, close fracture yung injury niya. So, unang-una is supportahan natin yung joints sa taas or yung sa baba, yung na-injury ng kamay natin hanggang ma-immobilize natin yun ng sling or bandage. So, second, tumawag ng 911 for help emergency na may leg injury na or may nagkaroon ng fracture. So, next is if yung hospital or yung ambulance mag-delay, ang dapat lang natin gawin is secure yung injured part para hindi na maka-affect yung injury na yun sa iba pang part ng body. Yun. So, dapat i-monitor natin and i-record yung vital signs habang iniintay yung tulong. Tapos, i-check natin yung circulation ng blood niya every 10 minutes. Next is yung special case protruding bone. Build up pads of clean, soft, non-fluffy material around the bone until you can bandage over it without pressing the injury. Ang aim natin dito is ma-prevent natin yung blood loss ng injury. Of course, as long as possible, madala natin kagad yung patient sa malapit na ospital.
Burns. There are different levels of burn and there are different causes of burns. Assessing a burn is depends on the degree level or the types of burn. The types of burn are dry burn, scald, electrical burn, radiation burn, chemical burn, cold injury. There are 3 depths of burns. Number 1, superficial. Superficial does not usually require medical assistance. It is usually healed by appropriate applying first aid. Number 2, partial thickness. First aid must be applied first before the medical treatment. Number 3, full thickness. Urgent medical attention is required because it affects all layers of skin and nerve and tissue is damaged. Burns that require hospital treatment. If the casualty is child, seek a medical advice or take the child to the hospital. And for adults, medical attention should be sought for any serious burn.
Una natin dapat gawin after the injury is lagyan ng malamig na bagay ang isang part sa ating nasunog na katawan. Pangalawa is tumawag tayo sa pinakamalapit na emergency para tayo ay matulungan at kung ano yung dapat nilang i-advise sa atin na mailagay dun sa nasunog na part. Pangatlo is i-continue lang natin yung paglagay ng malamig na bagay dun sa area na nasunog. Pang-apat is wag hawakan yung part na nasunog and wag magdikitan ng mga accessories, belt and shoes or the clothing, which is burn to prevent tissue swelling. Ang 5 is kapag nararamdaman mo na malamig yung part na yon, takpan natin ito ng like plastic or malinis na towel para hindi siya malagyan ng dumi na kakaroon ng infection sa atin. Pang-6 is i-monitor natin yung isang pasyente kung okay ba yung kanyang paghinga, okay na ba yung injuries na nangyari sa kanya. At ang dapat nating tandaan is wag lalagyan ng lotion or ointment na para i-substitute na gamot dun sa nasunog na katawan dahil mas lalo siyang magti-trigger or lalong mas lalala yung sakit tsaka yung kirot doon sa part na nasunog. Number 1, para matanggal yung init doon sa part na nasunog at matanggal yung sakit. Number 2 is dapat mapanatili na bukas yung daluyan ng hangin. Number 3 is para mabawasan ang trauma na maidudulot nito. Number 5 is para hindi ito lumala at maiwasan ang infection.
Minor burns and scalds. Nakukuha itong incidents like matapunan tayo ng sobrang kumukulong tubig or madikit tayo sa isang bagay na sobrang init. Yung balat natin is napapasok. So when it comes in the situation, better do the cover it with plastic wrap or place in a clean plastic bag over a foot or hand to absorb the heat of the skin surface. The next topic is choke. Pag ang tao ay nakalunok ng isang malaking pagkain, ito ay bumabara sa ating lalamunan. So, nagkakos siya ng pagkabara or pagkahina ng ating paghinga. Ang dapat natin gawin when it comes in the situation is i-encourage natin yung tao na patuloy pa rin siyang umubo para mailuwan niya yung bumara sa kanyang lalamunan, then maiwasan yung pagbagal ng ating paghinga.
Fainting. Fainting is a brief loss of consciousness caused by a temporary reduction of the blood flow up to the brain. Things to do when encounter fainting. First, lie down and elevate the feet. This may prevent a loss of consciousness fresh air can also help, especially if you